I'm Michelle Day. I'm going to be doing my deep tendon reflex skills videos today. This is my volunteer. Do you consent to be recorded and to participate in this video?
Yes.
Okay, so before we start, I'm going to do a room scan. Okay. Okay. All right, and then I'm going to begin. So I'm going to walk into my patient's room, provide privacy, do hand hygiene, introduce myself to the patient. Hi, I'm Nurse Michelle. I'll be your nurse today. Can you tell me your name and your date of birth?
It's Dustin Day, January 5th, 1989.
Okay, thank you. I checked that against his wristband. So today we're going to be checking your deep tendon reflexes. So we do this to check your nervous system to see how well it's working and how it responds to automatic stimulus. We also check this with pregnant women. It's really important for them. We check this to see if there's a risk of preeclampsia. Also, if they're on magnesium, we check this if there's absent or diminished reflexes. That may mean that there's a sign of toxicity, so we also check that for that reason. So we are grading this on a scale of 0 to 4, 0 being absent, 1 being diminished, 2 being normal, 3 being brisk, and then 4 being hyperactive with possible clonus or without clonus. Do you have any questions?
No.
Okay, so we're gonna check your bicep, tricep, patellar, and then Achilles, okay? And we're gonna use a reflex hammer, so we're gonna start with your bicep. So just go ahead and put support, or have, support there. And then I'm just gonna feel. And then with the pointy side, I'm just gonna strike on my thumb. So that's a 2, so that's normal. So now we're gonna check your tricep. So go ahead and just relax your arm, just let it dangle. And then I'm just gonna feel for your tricep. And then with my thumb, I'm just gonna strike with the pointy part of the hammer. So that's a 2, so that would be normal. And then now we're gonna check your patellar. So we're gonna feel right beneath your kneecap. And then with the flat side, we're gonna strike. Okay, good, so that's a 2, so that would be normal. And then we're going to do your Achilles. So I'm gonna dorsiflex your foot. And then with the flat side, we're just gonna strike on the back. Good, so that's normal. And then we're gonna check for clonus on your ankle. So when you dorsiflex the foot and you let it go, it should just drop, and that's normal. But if it's abnormal or positive, you would dorsiflex the foot, and when it drops, you would see it twitch a couple times, which would indicate clonus, which means that there's a risk for seizures. So that's everything. Do you have any questions for me?
No.
Are you comfortable?
Yes.
Okay, so I'm gonna perform hand hygiene and then go document my findings. Thank you.